When you think of the operating room and people associated with it, you probably think of a surgeon or an anesthesiologist. Today, however, I'm going to inform you about the surgical technologist and their role in the operating room. The surgical technologist is a surgeon's right-hand man. It is their job to open the sterile supplies, to gown and glove the surgeon, and to assist the surgeon by passing instrumentation during the procedure. Today, I'm going to show you how to set up a surgical back table. In a normal situation, I would be wearing a mask and goggles. The first step in setting up a back table is to drape the Mayo stand. The Mayo stand is what the surgeon and the surgical technologist will work off of during the procedure. When I drape this, I want to keep my hands protected because that is not sterile yet. So I step up and I slide this on. Now this is sterile and I can pull it into my field. The next step is to add an extra layer of protection. This prevents contamination. So after I have added this layer, I can move my instrumentation over close to my Mayo. During the procedure, the surgeon will use retractors. These are called goulets. They aid in visualization. The surgeon will also use scissors, a Mayo, and a Metzenbaum to cut tissue. The surgeon will use clamps such as a right angle or a Babcock. There are many instruments in surgery, but you use those that apply to the case. The next thing you would add to the Mayo stand are sponges to aid in visualization. It is important that you count sponges before, during, and after the procedure so that you don't leave them in the body. After you have moved up your sponges, you can now move up your suction. Suction also aids in visualization. You can move up your bogey. It cuts and coagulates tissue. And you can move up your syringe for medication. The next step is to move your sharps. So sharps consist of needles, hypodermic needles, and a blade for your scalpel. It is very important that you keep your sharps in the same place throughout the entire procedure so that you know where they are to prevent getting stuck with the needle or accidentally cutting yourself with the scalpel. The next step in setting up the surgical back table is to gown and glove the surgeon. So at this point, they would come in, you would gown them sterilely, and then you would drape the patient. Now this is already draped out, so I'm not going to show you how to do that. Now that everything is set up and everything is ready to go, we can move our sterile field to the patient. As I do this, I'm always making sure that my sterile field is protected and that if someone isn't sterile walks by it, I make sure that they don't touch it. This Mayo stand comes right up to the patient because this is what we will be working off of. The surgeon will stand here and I stand here. It is my job throughout the procedure to pass him instrumentation. As you're passing instrumentation, it is important that you pass it as it will be used. So if my hand is the surgeon, I would pass it just like that, so that it's ready to go. Another job of the surgical technologist is to be able to anticipate the surgeon's needs. To do this, the surgical technologist must have a background in anatomy. They must know the body and its functions, and they also must know the procedure. It is also important to be detail-oriented as a surgical technologist. Another role of the surgical technologist is to suction. So if there's a lot of blood in the area, it is their job to suction it so that the surgeon can see what they're working on. The main priority of the surgical technologist is always on the patient. The patient is always number one. It is their job to make sure that the field stays sterile, preventing infection in the patient. It is their job to make sure that the surgeon is happy, because when the surgeon is happy, the patient is happy. It is also their job to make sure that they know where all the sharps are and the sponges so that they don't leave anything in the patient. The surgical technologist is a vital member of the operating room team. They are there to help. They are there for the patient and to make sure that the procedure goes well. This job can be somewhat demanding, but at the end of the day, it is very satisfying.